Children's mental health is foundational. The impact COVID-19 has had on youth and families is significant. And we're seeing that impact through children's social emotional well-being.
We've had just a tremendous uptick in mental health problems in the youth. The acuity, the severity, the sheer number has increased so dramatically that it can be overwhelming.
It's incredibly stressful and hard for the patient who is already suffering to know that they have to wait to see a specialist.
Nationwide, there's a shortage of child and adolescent psychiatrists, and there's such a shortage in the state that sometimes that capacity is not there.
A wait list is not a care plan. There's a level of response time that is needed, and some people can't wait.
They end up in situations that are the result of mental health being untreated.
Trauma just sort of continues to perpetuate, and just really the health of our community really suffers.
Population-based care is needed now more than ever. We need to think about different ways of providing this individual level mental health care, because what we know is that the current system's approach is not working.
Vermont CPAP is a free, fast access service that you can call Monday through Friday, where we've got qualified licensed clinical social workers and psychiatrists. You call us with questions about the pediatric patients that you're serving. We can help with diagnosis, assessment, medication management, treatment planning.
And the goal is to both support the families in the primary care provider's practice and the primary care providers themselves, so that they don't burn out trying to provide really excellent care to so many kids, but without anyone to talk to.
Any primary care office in the state can register with the Vermont CPAP. They then have the capacity 5 days a week to call in with really any question they may have.
And the first warm voice that they're going to hear on the phone is a liaison coordinator like myself. So our first role is to welcome them, kind of get a quick assessment of what their question is, and then based on what their needs are, we individualize kind of where we send them.
And if it's more a question that's suitable to go to the child and adolescent psychiatrist, then there are currently 4 of us who are manning the phones, and the goal is to return any call within a half an hour of when it's placed, to free up some of the capacity to have more of the children that are suitable for being treated in the community. Makes a lot of sense.
Community and community partnerships is a huge part of the work that Vermont CPAP is doing. We will look into some of those other community-based resources to really kind of support the treatment plan. Regardless of where you are, you can call us, we're going to give you recommendations, we're going to support you in the work you're doing.
There are so many states adopting these programs because it's actually a very cost-efficient way to provide expertise immediately to primary care providers and immediately then to families. It is a very cost-effective way to provide equitable care across the state, especially in a rural state like ours.
VT CPAP has enabled us to have just yet another tool in our toolkit.
This program can help us both expand what we feel comfortable with and maybe even our scope of practice, and therefore help alleviate some of that bottleneck to psychiatry.
I can provide better care for my patients, and I see the success of it already with some of the patients that I've co-managed with Vermont CPAP.
Whether they're in Newport, whether they're in Bennington, whether they're in Burlington, that's really about creating equity, a continuum of equitable care, which in a state like Vermont is critical.